physician from the Metro East area of Southern Illinois. And I am here to represent Physicians for a National Health Program of Illinois and PDA, and actually I belong to almost every group that supports single payer. As a physician, I know Medicare works. I've been a provider for we won't say how many years, and I know that if I write a Medicare claim, and it's a good claim, clean claim, they pay me on a fee schedule that's published every year. And they pay me right. They don't make the patient hate me for billing them, and they don't make me hate the patient for running away from their chip. So I know Medicare works. I'm also now a Medicare recipient. I've had good health insurance all my life because I've had my husband's had good jobs in corporations, unfortunately, and I've gotten good health insurance. But once I got on Medicare, Medicare works. I mean, Medicare is great. You have your choice of doctors, your choice of hospitals. The only thing right now, it's expensive because, I mean, I can afford a supplement, but it's expensive, and I can also afford a prescription plan, but we shouldn't have to do that. We need Medicare for all. And also, I'm a small business owner. I make sure my employees have health insurance, and I try to make sure they don't pay any premium. I pay the premiums, they pay the deductible, and I keep the deductible as low as possible. So I try to keep it at 1 year, sometimes it's been zero, but now it's at 1,000. I try to also make sure they get something back for that because my employees are important to me. They make my business, so therefore, and they're my friends. So I am fortunate because I can afford as a small business owner, but it's not easy. Medicare for All would help small business owners, would help more entrepreneurs could get started because of Medicare for All. So, you know, we have a great crowd here. And I mean, as a doctor, I have to say one thing: get your shots, get vaccinated, because we need to do that so we can have more outdoor groups and we can start showing the people who actually, many of the people support us, but they're silent about it. We know that Medicare does real well on polling. Medicare for All does well on polling. We just have to convince our elected politicians who, no matter what we want, they don't seem to ever want it for us. So we need to make our politicians responsible and get this going. And if the more we demonstrate and the more we come out, the more they'll know it. And I mean, I'll just let you know one thing. We did an Illinois Single Payer Coalition. We tried to have a survey whereby we asked people if they would prefer Medicare for All over their own employer's insurance. We got about 100 people who answered they would have Medicare for All. But there was a recent study that had 195,000 people that were polled. And of those, 85% of the people with employer health insurance experienced problems getting insurance. They also delayed visits. They didn't take all their medicine. So we need to do better. I mean, I'm not supposed to say to some conservatives, you can't say health care is a human right, but it is a human right. I mean, to me, it's part of life, liberty, and the pursuit of happiness, which is, I think we have the right to demand. So we need to all get together and get the word out, sign petitions. PNHP now is embarking on trying to get our medical societies to support resolutions to endorse Medicare for All. We tried the AMA, we haven't yet convinced, but we have them at least talking about it after last year's demonstration, or 2-year demonstration in Chicago. So we want, and now we're going to write our societies. In addition, there's a movement from nurses, the Medicare resolutions, trying to get in your townships, in your cities, in your whatever community, your counties, a resolution passed by your boards to say they support Medicare for All. So we need to have a universal proclamation, because when Senator Durbin answered us over the patients over profits, he said before he would do anything, he wants to interview the people to find out if they want to give up their employer's health insurance. Well, Senator Durbin, that answer is in that new article with 195,000 people who agree they want Medicare for All. So keep working. We need to get everybody. Tell everybody you know about Medicare for All. Talk to people in the grocery store. Wear a button, and so they'll ask you. I mean, I talked to the cab driver today about Medicare for All. So keep the work up, and we'll keep the work up. We can all do it if we work together.